So this is the video abstract for a study I did for developmental science, looking at the issue of whether screen use or social media use, specifically in teenagers, can be associated with an observed increase in teen suicide, teen mental health that has been occurring at least in some countries like the United States. So what has been occurring is in the United States and some other countries, we've been seeing an increase in suicide rates among teenagers. Now, that isn't specific to teenagers, and a number of other age categories have also been seeing an increase in suicide. So middle-aged adults in particular have been seeing a fairly massive increase in suicide rates and have the highest suicide rates overall, which is interesting. But of course, a lot of the attention is focusing on teenagers because they're young, their lives are ahead of them. And we're particularly concerned about the welfare of teens. So there's been a little bit of a debate looking at whether things like changes in patterns in screen use can be one of the factors that may be related to an observed increase in mental health problems, depression, suicidal ideation among teenagers. And particularly what some scholars have been arguing is that these kind of changes, particularly around the year 2009, 2010 or so, may be responsible for, at least in part, this increase in teen mental health issues. So particularly what people are concerned about is the introduction of things like social media or other changes in screen use may have played a causal role in increasing teen suicide. So this was one thing that I wanted to see if there was any evidence for, and it would stand to reason if changes in screen use around 2009, 2010 were responsible for an increase in teen suicides, that when we look at correlations between screen use and mental health problems like depression or suicidal ideation, we ought to see a strengthening relationship between these two variables. So again, if there is a change in how kids are using screens and that change is causing mental health problems, we ought to see higher effect sizes when we look at these correlations. So I wanted to examine this with a couple of data sets that spanned that time frame, that looked at teens beginning in the early 2000s and then continued looking at teens until we got to the late 2010s, essentially. And there were two data sets that I used in the study, and one was a large study of Florida kids that spanned from roughly the years 2001 until I think it was 2017. So again, spanning that time, looking at in different cohorts the relationship between screen use and suicidal depression in this situation. So very, very serious depression symptoms. And again, what I was looking for was, first up, is the relationship meaningful? Is there any really correlation there at all to begin with? And if so, are we seeing an increase in this correlation between screen time and suicidal ideation that could lend support to this belief that these changes occurring around 2009, 2010 could be attributable to some of these increased problems? The second data set I used was a sample of youth in the United Kingdom, kind of spanning roughly the same time period in four different cohorts with roughly somewhere around 4,000 kids in each cohort, so another relatively large sample. Kind of looking at the same thing. The difference being with the United Kingdom kids is instead of screen use generally, the data looked specifically at social media use. So again, social media being one of these areas that people were particularly concerned about. So looking at social media and again, seeing if changes in people's use of social media, such as using things like FaceTime, Twitter, etc., that became more prevalent roughly around 2009, 2010, would lead to some kind of strengthening relationship between the amount of time spent on social media and these symptoms of mental health difficulties that kids were experiencing. And what I found is basically in both data sets that there really was not much evidence for a correlation or relationship between screen use generally or social media use specifically and mental health problems in either group of teens. So the correlations were just too small. They're pretty close to zero, and therefore are not evidence for a meaningful relationship between these types of screen use variables and mental health in teenagers. And also there did not appear to be consistent evidence for this sort of increasing strength of a relationship between either screen use or social media use across time. So basically, in this study, there did not appear to be evidence to support this idea that changes in screen use, around the turn of 2010 could be attributable to a strengthening relationship between screen use and mental health problems in teenagers. So, as a result, if we're really serious about tackling this issue of mental health issues in teens or teen suicide, it looks like other variables are going to be, or other issues are going to be more important than looking at screen use. So for policymakers looking at, or mental health professionals or anti-suicide advocates, looking at screen use specifically does not look like it's going to bear a lot of fruit for people. Now, I assume that, of course, debates about screen use are going to continue. There's a really passionate debate that's kind of going on there between different groups of scholars. I'm sure that no one study is going to change that, but and I do look forward to more research coming out. My study was a registered report, which means that the hypotheses and data analyses were agreed on with the reviewers in the journal in advance of looking at the data, which makes it such that researchers can't fiddle with their data to try to get the results that they want. So I would look forward to more pre-register studies and registered reports that are a little bit stronger in terms of our confidence in the data. But I hope that my study was a useful contribution to this debate moving forward, and look forward to more data coming out. Thank you for listening.